okusobola okudda kubanga bwe nti si bwe nnali.
Memang kalau datang sakit, hanya orang kanser je yang tahu macam mana kesakitan kanser tu sebab dia silent.
Tenía una enfermedad, un cáncer, y no tenía ningún tipo de solución. Entonces, yo me he dado cuenta que yo no estaba preparado para la muerte, pero también me he dado cuenta que no tengo miedo a la muerte, tenía miedo al dolor.
90% of the world's population lack access to pain relief. So if you have advanced cancer in a low or middle income country, you are probably going to have horrible pain.
If planned at an early stage, good palliative care can prevent unnecessary interventions, saving costs and increasing the quality of life for patients and their families. While there has been progress, too many people still do not have access to this essential health service.
When you go out and ask the public what is palliative care, most of them will have no idea what you're talking about.
Cuidados paliativos es la atención integral de la persona que sufre porque tiene una enfermedad grave. Es muy interesante ver que en esta definición no aparece ni el término terminal, ni siquiera la palabra muerte, ¿no? Sino la razón es que la gente sufre.
For many of the patients that I see, one of the most important problems they tell me about is pain. Every day I see people who come to me and says, I need palliative care now, and there are hundreds and thousands more in need of hope.
My first thought about palliative care was the end of my life, and I was about to ask my doctors, how long do I have? My doctor told me, you just go back and live your life. I can express my feeling, my pain, and I get answers from them. I couldn't get that from the hospital.
It's science because there is this big body of work that has been done there, the research that exists and will help us treat the best that we can pain and other symptoms, but also it's added the art, which means caring for the whole human being, which is social, human part, psycho-emotion and spiritual care, and also for the family, which is part of the team.
Most of the countries that are needing access to pain relief such as morphine are not able to access it. So much of the use of essential medications such as morphine is being used by the well-resourced countries.
When the palliative nurses introduced morphine, I said, morphine is no good for me. I get addicted. Then they laugh at me. No, morphine takes away your pain.
And what you see on the screen is palliative care is the kind of care that you and I would want if you or me or someone we love is seriously ill or dying. This is a human rights issue. So whether it's in the United States or Kyrgyzstan or Africa, around the world, until societies come to expect a higher level of care, it's very hard to make change.
In Kyrgyzstan, we have around 7 million population, and only 30 beds. Palliative care needs not only for elderly people. Palliative care we need to give to children and their family too.
In my country, Greece, approximately 3,000 children are in need of palliative care, but only 30 of them have access.
Αυτό που δικαιούται να έχει σαν παιδί είναι η φροντίδα. Είναι δικαίωμά του, είναι δικαίωμα όλων των παιδιών που υποφέρουν από απειλητικές για τη ζωή τους ασθένειας και θέλω να την έχει μέχρι την τελευταία στιγμή της ζωής του και της ζωής μου. Όσο είμαστε εδώ, σε αυτή τη ζωή, να ανακουφίζεται και να έχει μια καλύτερη ποιότητα ζωής. Που μακάρι να την έχουν όλα τα παιδιά που είναι σε μια ανάλογη θέση.
Χτούνε καρδιές να ακούσουν αυτό που προσφέρετε εσείς στο Γιάννη και σε όλα τα άλλα παιδιά που είναι σαν το Γιάννη. Μακάρι να ήταν η κρατική αγκαλιά πιο πλατιά.
Για να μπορέσουμε να διαχειριστούμε καλύτερα ένα σύμπτωμα του παιδιού, είναι πολύ σημαντικό να δούμε και την ψυχική διάσταση του συμπτώματος και την οργανική του διάσταση. Αυτό θα ήταν μια ιατρική επανάσταση.
Palliative care is the new dawn for healthcare in every discipline. When somebody comes at the hospital or maybe you go to his home, he is not a car, she's not a car, she's a human person. So we don't treat the disease, but we are trying to see that person as a whole. This person has a disease, but she's not the disease. She has a system, she has relatives.
Change things for the better. For palliative care to be developed and integrated fully into health systems, we need to work together as a team. We are also seeing patients raising their voices and stating the needs they have and the challenges they have so that governments can respond appropriately.
You're already dealing with a marginalized group or a group that finds itself in a vulnerable situation. How can a patient with cancer who's a child just stand up for themselves, right? And that's why we require institutions such as the United Nations, for example, to do the work of standing up for rights holders. Palliative care centers around dignity at all stages of life. It's also for me about, maintaining a life of dignity no matter how long a person has to live. And so palliative care is a human right because dignity is a key principle of human right.
We need a public that's really engaged and expects and advocates in the same way that any other aspect of healthcare has ever been changed in society. It changed because people expected it.
We need to be treated with dignity. We are valuable and meaningful till the end of our life.
Over the years, one of the things I remember poignantly are the faces of patients and caregivers that I meet. There are faces filled with sorrow, with angst and agony. And I think palliative care brings hope.
When I'm not in pain, my family is not in pain. Palliative care has given me hope to live and to have a better life.
Nuestra sociedad se ve impactada con ese sufrimiento, porque por un paciente enfermo, con una de estas enfermedades sufre toda la familia.
In 2014, the World Health Assembly adopted a historic resolution committing to strengthen palliative care around the world. Last year, I wrote to all heads of state around the world about the importance of ensuring access to palliative care and offering WHO's technical support. Our top priority remains supporting countries to build resilient health systems that can deliver essential health services, including palliative care, even in the most severe crisis.
Suelo decir que cuidados paliativos no es negro como la muerte. Cuidados paliativos tiene colores. Cuidados paliativos tiene infinitos matices de vida, de alegría, de felicidad.
If we will make it an issue not only of the medical professionals, but also of the community, of how to better care for humanity, I think it will be a better world.
It shouldn't matter where you live, what gender you are, you should have access to appropriate, good palliative care throughout your life.
Saya sebagai pesakit kanser mengesyorkan palliative care ini menjadi hak asasi manusia seluruh dunia.
Es paz y es luz y es amor.
At the end of the road, will you get what's owed with balm for the soul and from the pain as you sing your last tune with a last look at the moon. Come and sing this refrain. May your journey be swift and joyful as if oh, your wishes and dreams so come true. And as you go fly and watch us from on high, know that we're always with you. At the end of the road, at the end of the road, at the end of the road, will you be with me? At the end of my road, at the end, at